Good evening, everyone, and thank you for joining again tonight. I had a little bit of technical difficulties because I want to again show a couple of slides to you, but we will share the screen tonight as opposed to having it a part of the presentation. Thank you for joining. I'm Carolyn Curtis. I am the president and CEO for the Carib Company. Tonight, we're going to talk about cesarean section. There's been a lot of information recently in the news. As you know, and in an earlier video, I talked about a cesarean section that was done in 2016 that had very unfavorable results. This was a planned cesarean section that was being done for the second time. This was the daughter-in-law of Judge Hatchett that we know from TV. And there were very undesirable outcomes where her daughter-in-law died as a result of complications from that cesarean section. But what I'd like to do tonight is to talk about cesarean section to help you as you understand more about your body, your risk factors, understand the cesarean section rates of different hospitals, that you will be able to understand even more so why a cesarean section would be needed and what are some of the risks related to cesarean section. So if you will give me a minute, I'm going to share my screen this time and we will talk more about that. So hold on. But give me 1 second to get to that presentation. Tonight, it's just a few more technical difficulties, so bear with me. Okay, so as we move forward, I'm hoping that you can see this. I'm not able to see you, but I want to make sure that you're able to see the information for cesarean section. The reasons why cesarean section would be done are for the following reasons. I talked a lot about being well rested before you go into labor. And if you are very exhausted and not able to cope well with your contractions, your body is not able to work as well as it could. And so, therefore, we can move to where you get very, very tired and fatigued, and then your labor progress does not advance. And so, prolonged labor would be one of the reasons for cesarean section. This is where you just exhausted. You're very, very tired and your uterus is not working well. And so the progress is not made in terms of the dilatation of the cervix that we talked about before. The other is if you have an abnormal position of the baby. Breech positions, babies that are in breech are able to be delivered vaginally if the provider knows how to do that. Unfortunately, this is not well taught in medical school. And so there's often also not many opportunities to be able to learn how to do breech position. And so the fallback is to do cesarean section if the baby is in a breech position. This is one thing to ask when you interview providers, is to ask about whether or not they have any experience with a breech position and what would happen if your baby ended up being in a breech position. Fetal distress is when the baby is having trouble, and this is indicated by decreases in the heart rate on the fetal monitor with contractions that do not recover after the contractions are done. Reasons for this can be We have what's called meconium staining. Meconium staining is when the baby has had a bowel movement inside, and when the bag of waters is broken, instead of the bag of waters being clear, it has a greenish color. And so that is not necessarily to say, depends if it's a fresh green color and the meconium is a thick, when we say pea soup, think about pea soup, that is indicating that there is distress happening at this point in time. So the baby would be watched very carefully. Also, if infection has set in, we talked about this in the last video, where if you have broken the bag of waters for a period of time, that beyond 18 hours, the risk of infection greatly increases. And so this can also cause fetal distress. But this is where the baby is not reacting well to the contractions, does not respond well when the contractions occur. And so this is letting us know that it is healthier for the baby to be outside of mom as opposed to continuing with the labor. Birth defects, depending on the type of birth defect, it may be advisable to do cesarean section for that. Repeat cesarean section, and I'm going to throw this in, and we probably will need to talk about this in another video, but if I've had a cesarean section, the question is, do I always have to have a cesarean section? The answer is no. You have to understand what was the reason why the first cesarean section was done, and understand, is that reason still valid for this pregnancy? Once you've had a cesarean section, all of these factors would be evaluated, but it is possible to have a vaginal birth after you have had a cesarean section, and even after you've had more than one cesarean section. So it is possible to have a vaginal birth after your cesarean section. It is something to discuss with your healthcare provider. Chronic health conditions, it depends upon the mother's health. Things such as preeclampsia is one. If there are cardiac issues, these are health issues that may warrant a cesarean section because the mother's health is now in jeopardy if the labor continues. Again, this is something that would be monitored throughout your pregnancy as to what your health condition is. We've talked about the preconception visit, trying to get yourself in the best shape possible for your pregnancy before pregnancy happens, so that you can have as healthy a pregnancy as possible and as healthy a birth as possible. Cord prolapse. What is a cord prolapse? That is when the cord drops below the head in the pelvis. And then when contractions happen, what can happen is then the head goes up against that cord and kind of has it in between the cord and the pelvis, which can cause serious problems. This is something that could be an emergency cesarean section. And then the cephalopelvic disproportion, CPD. I want to warn you that this is often used. And what this means is to say that, oh, well, we don't think your baby is going to be able to fit through your pelvis. And if you have never had a baby before, I want to caution you about hearing these words during your pregnancy, because the test of whether or not this is true is for you to actually have labor. And then if the labor does not move forward, then you can say, well, we have cephalopelvic disproportion. This is different than prolonged labor. What cephalopelvic disproportion is that you can, the head does not come low enough in the pelvis. It does not advance in the pelvis. And last time we talked about station above the ischial spines being at -2, -3, -1. When it's even with the ischial spines, it's 0, then +1, +2. What happens with the cephalopelvic disproportion is that the head never gets down to the 0 station. and therefore it continues to be high above the ischial spines, which is an indication that the baby may not fit through. And this you're able to tell when you are in labor and seeing what progress is made in labor. I want everyone to be fully aware that cesarean section is major surgery, and it's done so often. The average rate of cesarean sections in the United States is 32%. And when you are to look at hospitals, we talked about this in an earlier episode in terms of looking at the cesarean section rate, the baby-friendly hospitals, the safety of hospitals. We can find out what are the rate for cesarean sections in each hospital or hospitals near you. My family is in Southern Maryland. There are 3 hospitals that are all within equal driving distance. One has a 42% cesarean section rate, and a half hour away, the other one has a cesarean section rate in the 20%. It makes you want to ask questions. Why is one hospital way over what another hospital is within the same area, pretty much? So that's something to ask. Even when you go to your provider, you may want to ask them, what is their rate of doing cesarean sections when you're working with the OBGYN? Midwives do not do cesarean sections. So this would be a question to ask. How many, what's the average rate of cesarean section for their practice, which will give you somewhat of a heads up as to how they're doing with the rest of the world. If you look at America's best OBGYN hospitals, the cesarean section rate is below 20%. That says something. So let's look at some of the risks to mom. There was a study that was done in Canada that the American College of Obstetrics and Gynecology has on their website. And that study looked at first-time moms. Prima gravida means first-time pregnant. And they looked at a study that looked back to look at for those who had a planned cesarean section and those that had vaginal birth, what were the outcomes? And these were the increases that occurred for women who had cesarean section. There was an increased risk of heart attack after cesarean section. Wound hematoma is where there is like blood clot around the wound area. Hysterectomy was done. Hysterectomy can be done depending, we're going to look at that with the next slide a little bit more, because of the placenta, where the placenta attaches, and what it does is that it may attach too far into the uterine wall. And to try to remove the placenta, we talked last time that if you would give the placenta time doing a vaginal birth, it can deliver on its own. When you have a cesarean section, the next time you become pregnant, it's possible for that placenta to get implanted a little bit too far into the wall of the uterus. And then it's very difficult to have it be detached from the wall of the uterus without causing excessive amounts of bleeding. And so your only option left is to do hysterectomy. Puerperal infection is infection in the post-delivery period of postpartum, that there was increased risk of major infection. Anesthesia complications. Anesthesia is required for cesarean section. Either general anesthesia, which is not used most times, it's epidural. However, you can have some complications from the anesthesia. Thromboembolism, meaning blood clots, that you have an increased risk of blood clots when you have cesarean section. We just talked about the hemorrhage that requires a hysterectomy, a longer hospital stay. We're going to talk a little bit about some of those things that cause the hysterectomy, placenta accreta and placenta previa. To the left, you can see 3 different pictures, one that shows the placenta in a normal position. And then we have what's called a low-lying placenta. What's very interesting to know is that every single time you become pregnant, the placenta implants in a different location on the uterine wall. It doesn't implant in the same place it did with the previous pregnancy. And so, with the more pregnancies that you have, there's an increased risk of the placenta being either what's called a low-lying placenta, where it is close to the opening of the uterus called the cervix, or it can actually cover the cervix, which is called placenta previa. And with the low-lying placenta, you need to be very careful that as the cervix opens up, that it is not near the cervix to cause excessive bleeding, because that placenta has loads of blood vessels. This is and it's also kind of the baby's lifeline. And so if anything happens to that placenta, it can really cause danger for your baby. Then the placenta previa. And so each time you become pregnant, particularly once you've had cesarean section, then the risk for what's called a creta, where it implants a little bit deeper than usual, that chance increases. And so when that happens, then the risk of needing to have a hysterectomy, because you cannot get the placenta delivered without loads and loads of bleeding, increases. That's what we would call that gravity hysterectomy. Keep in mind that there are also risks for the baby. When the baby is born with a vaginal birth, the pressure of coming through the pelvis puts a lot of pressure on the abdominal wall all along the chest. And what it will do is that it will push fluid out of the lungs, out through the mouth and through the nose. That is a normal thing that happens. When you have a cesarean section, that process does not occur because the baby is not going through the pelvis. And so there's an increased risk of respiratory problems for the baby. Those things can be transit tachypnea, where the baby's breathing is faster than normal, respiratory distress syndrome, and then pulmonary hypertension, which can happen as well. So these are the risks associated with pregnancy. So let's come out of this now. Sorry for all of my technical difficulties tonight. But let's make sure that if anyone's on to have any questions, that they can certainly list those questions or be in touch with me. But that is what we're going to have for our presentation tonight. Next week, we're going to talk more about repeat cesarean section. Do I have to have a cesarean section if I've had one before? To talk about some of the pros and cons with that, so that you understand fully informed consent around cesarean section, and also around repeat cesarean section. So if you have liked the information that I have shared tonight, I ask that you will like and subscribe to my channel. When you subscribe to the channel, it allows you to be able to be notified of any new presentations and that will be going on. I plan to continue on a weekly basis at this time. I'm also doing some shorts to be able to get you to see quickly what's being featured in some of the videos. I also ask that you will share this with your friends. As I always say, share this with your mom, your dad, your aunts, your uncles, your sisters, your brothers, nieces, nephews, friends, and cousins. So thank you so much for joining me tonight. I look forward to seeing you again next week. Have a good evening. Thank you. Bye-bye.